touch of the elbow is as close as you'll get to the doyen of infectious disease doctors at the moment. In a rare broadcast interview, Piot, who helped to discover the Ebola virus, said Covid-19 is far more of a threat.
Oh, this is much, much worse than Ebola. Ebola requires very close contact for transmission. People are very scared of it, but frankly, it is usually very contained. I mean, we have some exceptions, but it's because it's a respiratory transmitted virus. That makes it so worrisome, and it's very infectious because there's so much virus in the throat. So this is literally something you can catch by just talking to somebody.
He said President Trump's restriction on non-US citizens flying from many European countries makes little sense. The virus is already widespread and largely undetected in the United States.
I think once again President Trump took everybody by surprise by a decision which is frankly pretty bizarre in a sense. The US has in-country transmission, has lots of cases. So I can only think that this is a political decision, and it's hard to imagine that this would have any impact on control of COVID-19.
There will be many thousands of cases and more deaths in the coming weeks, but so far modern medicine has little to help those most vulnerable. Because there is no treatment, there is no vaccine, we're relying on good hygiene. It's almost back to the dark ages of medicine in many ways, isn't it? It's
yes.
Basic principles here.
It's like back to the times of the Spanish flu, 100 years ago, that killed, 50 million people. However, we have antibiotics that can treat pneumonia, there are respirators, we are better equipped, and I'm quite optimistic that, okay, let's say by sometime in April, we will have effective therapy. There's reasonable hope that we will know soon. Vaccine, that's going to take a much longer time.
The big concern is Africa. Ebola had a catastrophic impact on countries with under-resourced health services. Deaths from coronavirus could be even greater. And once again, the world will be called upon to help. Thomas Moore, Sky News.
Let's bring in Dr. William Schaffner. He is a professor of medicine in the Division of Infectious Diseases at Vanderbilt University Medical Center. Doctor, so good of you to join us. I don't want to freak people out here with the whole, the virus can linger in the air for 3 to 4 hours. Are we making too much out of that?
No, Trace, actually, I think this study shows exactly how contagious this virus is. It emphasizes the importance, among other things, of course, of surface disinfection, but also of hand washing, because it's our hands that touch the surface and then they touch our mouths. And so if we do a lot of good hand hygiene, we'll interrupt the way that virus can get from a surface to us.
And Jonathan just gave us kind of a surprising stat. Some of these new studies saying that you could be contagious with coronavirus for up to 37 days.
Yeah, Trace, that's the odd person. Most people don't, and the infectiousness of people does diminish rather rapidly after they recover from their illness. So yes, we always have the occasional odd person who can go out for quite a while, but that's fortunately not the majority.
Dr. Schaffner, I want to play what Vice President Mike Pence said this morning on Fox and Friends about this, and then get your response on the other side. Listen to this.
One of the things that we know about the coronavirus from our experts studying global data is it's 2 to 3 times more contagious as a respiratory illness. And so we'll have thousands of more cases across this country. But your viewers deserve to know that most Americans, the vast majority of Americans who even contract the coronavirus, will have flu-like symptoms and will fully recover.
And that seems to be a fair assessment, Dr. Schaffner, because of the information that we have looked at and the people we have talked to. Most people actually do fairly well with the coronavirus.
Fortunately, Trace, that's correct. And we're all very, very glad about that. It is said that 80% of people will have moderate or milder disease. Great. But we're also focused on that proportion of people who are older and, of course, who have underlying illnesses. We want to make sure that we take care of them because they're more apt to have serious disease.
Yeah, we're talking about the NBA now canceling the rest of the season. Other leagues have done the same. Big events being canceled, music festivals, so forth. What are your thoughts on that? Is that a proper response?
I think it's an excellent response because this virus is transmitted person to person largely through close contact. And by avoiding groups and having these large group events canceled, we'll be keeping ourselves somewhat separated, making it harder for the virus to find another person and another person after that to infect.
Does the designation, doctor, of this being now a global pandemic, does that change the physical way we approach this, or is that just a mindset? Is that a psychological term to kind of get us aware of what's going on around us?
It's a very important psychological mindset issue. It recognizes that we're now in a global problem. We're all working on this together, and nobody can say, gee, it won't come to my hometown. This really grabs everyone's attention and keeps us focused.
Yeah, as far as us being focused, I want to put this on the screen. These are symptoms of COVID-19, of coronavirus, and it is fever, cough, and shortness of breath. It's kind of short and sweet there, but are we missing something critical in this list, doctor?
Well, the shortness of breath obviously is on the more severe end. And sometimes on the less severe end, you can have people without fever. You can have people with primarily abdominal complaints, such as abdominal pain and diarrhea. So the clinical spectrum, as we're learning, is a little broader than we originally had anticipated.
Dr. William Schaffner, good information, sir. Thank you so much for the insight.
My pleasure.